So we have a question that we received, which was, what things can be mistaken for perimenopause, or what can perimenopause be mistaken for? What symptoms overlap with other conditions? And it's a really good question because a lot of the symptoms of perimenopause are really vague and non-specific, like heart palpitations, fatigue, weight gain, hair loss, skin changes. So how, Amy, do we sort of sort through all of that and determine, is it perimenopause? Is it something else?
I think it's a great question. And this is where I would actually start doing some lab work. So we often talk about how lab work isn't helpful for the diagnosis of perimenopause,
Correct.
but it's helpful for eliminating and kind of ruling out other things that could be causing your symptoms, like a thyroid disorder. So we definitely want to check for that and make sure that that's functioning normally. I like to check a ferritin level or an iron level.
Yeah.
So you may have low iron stores. Maybe your blood count numbers are okay, but it's good to check an iron level because that can get low and that can definitely cause fatigue, sleep issues, and things like that. Another one I like to check is vitamin D levels because that can also be kind of a subtle, if it's low, can kind of lead to some low-level energy issues or some hair loss issues. And if hair loss is your issue, I may also look for things like testosterone to make sure your testosterone level isn't elevated. I think it's important to bring these concerns to your physician and have a conversation because this is where lab work can actually be really helpful to make sure we're not missing something else that might be going on and we're not just blaming our perimenopausal overreactive ovaries.
That's a great point. The other thing I mentioned is heart palpitations, and we may or may not work that up because heart palpitations are pretty common through perimenopause. It sort of depends when you're feeling them, what you're feeling them with. We might do a small workup just to be sure nothing bad is going on, but oftentimes we'll watch and wait and sort of see if they get better as we treat.
Yep, exactly.